I'm Melissa Matson. I'm a nurse practitioner at the University of North Carolina Hospitals in Chapel Hill, North Carolina.
I'm Kourtney Russo. I work at the Center for Cancer and Blood Disorders here in Fort Worth.
Today we had the opportunity to lead a workshop around taking care of adolescents and young adults with cancer, which is a really unique population. Really, for some, it's just a few of the people that they'll see in a cancer clinic from year to year. For others, where you're at a larger institution, you might see more of them, but they have really unique needs. A lot of considerations that we were able to talk through today, which was really great. It was such a great opportunity to be able to come here and to do this workshop.
Absolutely. The AYA population is the ages from 15 to 39. So there's a lot of psychosocial aspects and different things that are a little bit separate from the side effects of the chemotherapy. Melissa actually started a group of advanced practitioners from across the country who are able to get together and share this information. Because this is a growing population. We are seeing more and more of that adolescent and young adult population with this cancer diagnosis, and we need to be cognizant of our approach to them should be a little bit different. So I am in a community outpatient center, so not only do I see AYAs, but I see other populations, and through this group, it's been very helpful for me to identify resources and different aspects of that care that we may not know in your average oncology. So that was basically what we were talking about today.
And while like she said, I think a lot of the symptom management is the same across the board, but conceptually you need to kind of approach a young adult a little bit differently than you do with most of the patients that you see who are older adults. Mm-hmm. So we talked through what some of the key issues are that we need to think about around the care of a young adult with cancer. And then we talked through specific resources to make sure they had those in your back pocket.
Absolutely. So, and then we also encompass survivorship care. Melissa did a great talk about, you still have the patient for another 60 years and that develops a comorbidity after you have chemotherapy. Most people do have comorbidities that they wouldn't have in their 20s and 30s. If they didn't have, chemotherapy, and that's important to recognize and important to be a part of that survivorship visit.
There are 2.1 million people in the U.S. right now alive who had their cancer during their adolescent young adult cancer years.
Our group was really, really involved. And they did, as far as the recognition in the psychosocial, the differences of what these patients are going through versus what your average adult population or even your pediatric population. Obviously, the survivorship care of that in a pediatric population is also very significant. But the aspects of the regression through the life cycles and the psychosocial aspects that they were able to recognize and take away and discuss, as well as like the fertility preservation that Melissa talked about, and the way that I feel like they were now able to better advocate for their patients, which is, another one of our goals is to educate other advanced practitioners about this population, and then have them feel comfortable enough to advocate and educate those and empower those patients.
I think at the end of the day, we want these young people to be able to get the cancer care that they need, and figuring out ways. Sometimes you have to be really creative with this age. People have all different sorts of distractions or other things, values that are different and not in line with necessarily what we as their medical providers think they should be doing. And so you have to be creative and flexible in thinking about that care. And I think the main thing we wanted to do in conceptualizing today's workshop was think about the 3 or 4 key topics that we wanted to address: fertility preservation, psychosocial concerns, and survivorship, and then give them specific tools. So one of the things we thought about was the NCCN guideline. They actually have one for adolescent and young adult cancer care. And there is a lot of guidance in there about addressing these topics. How do you think about fertility preservation with a patient? What treatments might cause infertility? So we wanted to give them some time at the end to work through some case studies where they could apply the NCCN guidelines and some of the other resources we gave them during the talk.
I think mostly, again, our goal is to connect people who may not have an AYA clinic or a specific AYA resource. to those resources, so that when you do have those patients in that population or they come up to your clinic, that you're able to recognize that NCCN does have something for that. There are, you can Google it, resources for adolescents and young adults, so that you can better take care of those patients. And if the one thing that people take away from, I think, our talk and from, I guess, this video, is that those resources are out there. We're out there, people are out there, people are advocating for this group. So we want people to be able to access those resources.
And I think at the end of the day, just showing up as your authentic self with them and recognizing that they're at a life stage that's really challenging to even have to be dealing with cancer, and that you want to help be there with them in whatever way is possible with some of these resources, and thinking about what's important to them, what they want to keep in their life as they're going through cancer treatment so that they can get through that.